I started as the Indiana Department of Health Commissioner in October of 2017, before the pandemic started. I spent a good part of my first year going around to all of our 94 local health departments and seeing how public health was delivered across the state. And what I found is that where you lived in Indiana really did make a difference in your access to foundational public health services in the state of Indiana. And then along came the pandemic, and the pandemic obviously shone a light on any areas where there were gaps or issues with public health delivery. The governor, after that, established a Governor's Public Health Commission so that we could look at public health across the state of Indiana and truly determine, what are the weaknesses that we have and what are the strengths that we have. And most importantly, how can we make sure that there's an equitable delivery of foundational type public health services across the state of Indiana? What does the funding need to be for that? What does the support need to be for that? And what are the other issues like workforce and the ability to be able to provide the type of resources that we need through our school systems? When you look across the state of Indiana, the delivery of healthcare, most importantly, those public health services that really help us to get on the front end of this and prevent a lot of those chronic health issues in the state of Indiana, is very inequitable across the state. We have counties that have a life expectancy that's almost 9 years above our counties with the lowest life expectancy. And Indiana overall is 40th in the nation when it comes to looking at life expectancy and comparing it to other states. We're about 2.1 years behind. So those things really make a significant difference for our Hoosiers across the state. And I think it's really important then when you look at the public health issues that have arisen from substance use disorder and our overdose deaths in the state of Indiana, it's important to note that that is occurring in our younger age group. So there's a lot of active, important years of life that are lost, and that is our workforce in the state of Indiana. And Indiana is a very economic, devoted, and dedicated state.